Hello everyone, my name is Catherine Woodworth and the title of my capstone is An Assessment of Parental Informational Needs in the Evaluation of North Carolina's Newborn Screening Educational Brochure. To give you a little background on newborn screening, it is a public health initiative with a goal to prevent death and disability through early detection of a variety of conditions. All newborns are screened within 24 hours of birth using a few drops of blood from their heel. North Carolina screens for 37 conditions, some of which are genetic conditions, such as cystic fibrosis or sickle cell anemia that you may have heard of. Others are endocrine disorders and metabolic disorders, hearing loss is part of the screen, and critical congenital heart defects are screened for. In the United States, parents can opt out of this newborn screen, but it is not as common, and follow-up tests are performed to confirm a diagnosis. As you can see here, this is an example of the North Carolina newborn screening brochure that's given out to parents. And so it goes through some different conditions and what they are, in addition to giving contact information for the Department of Health. This is the inside of the brochure, which goes through more questions and other conditions. And so as we will see throughout this presentation, parents are not often given this information before the child is born and therefore can be shocked or surprised if their newborn screen's positive for one of the conditions on the North Carolina newborn screen. So my goal is to create a brochure that may be easier to read and will hopefully be distributed in an effort to relieve this shock. And it will make genetic counseling appointments more focused on the condition and what that means for the family and the child, and what follow-up testing will need to be done, rather than having to backtrack all the way to what newborn screening is in general. So the first article that I'm going to talk about in relation to my capstone is called Newborn Screening: An Appeal for Improved Parent Education. And this was published by Tulzik et al. In 2009. The purpose of this article, this study, was to determine how, when, and from whom parents were informed about newborn screening, and to gather recommendations from parents to improve the education that they were given about newborn screening. The methods in this study were a retrospective qualitative study design that was part of a larger mixed method longitudinal project. Convenience sampling was utilized to recruit 193 parents of 100 children, so some parents were part of couples for each child. Children were less than 6 months of age who had had a normal newborn screen in Washington State. The children were confirmed to have cystic fibrosis, congenital hypothyroidism, to be cystic fibrosis carriers with only one mutation, or to have a false positive and actually be unaffected by a condition. The authors used a between subject study design, and data was collected from semi-structured interviews for these parents, and they included a false positive screen group for children who screened positive but were actually confirmed to not have the condition, and this was used to compare to parents with children who did turn out to have the condition. So the results of this study showed that 26% of parents learned about screening during their hospitalization following their children's birth. So while they were in the hospital waiting for the child to be born, 13% recalled receiving information from a healthcare provider during the prenatal period, and approximately 6% didn't recall receiving any information at all. Now, while 6% doesn't seem like that high of a percentage, parents not having any information about a test that their child will be undergoing is very concerning. Parents of children with confirmed conditions had information requests, and they wanted to hear the information both written and verbally, but they wanted it to be done in a better way. And they wanted emphasis on the importance of newborn screening and getting in to get that follow-up screen done in a timely fashion. And they noted that being misinformed or uninformed about newborn screening and what that meant and what the conditions were amplified their negative reactions when their child did turn out to have an abnormal screen. So as you can see, if we were to improve the education that parents got beforehand and improve that written communication, then ideally we would mitigate those negative reactions parents have to an abnormal screen. So the strengths of this study were its large sample size, the inclusion of parents of children with a normal conformational test result, and the semi-structured interviews, because this allowed us to gather qualitative information about the parents' experiences rather than just having them say yes or no or rate it on a Likert scale. So for the type of information I'm trying to gather for my capstone, this type of qualitative analysis is a strength. Limitations to the study included the sample's demographic homogeneity and the inclusion of only 4 outcomes. This makes it more difficult for the study results to be generalized to all of newborn screening parents. And another limitation is the small number of responses for some questions, so parents didn't respond very well to some of the questions being asked. There was recall bias because, the children were at least 6 months old. A lack of random sampling due to the convenient sampling used. Semi-structured interviews could have been seen as a limitation because they are harder to replicate down the road, although there are some questions that are asked over and over. And the data was from a larger study, and so this could have caused the methods to not be as directed and as good for the type of information that these authors were trying to gather for this particular analysis. So the second article that I'm using to inform my capstone is called Recommendations for Effective Newborn Screening Communication, Results of Focus Groups with Parents, Providers, and Experts, and this was published by Davis et al. In 2006. The purpose of this study is to evaluate whether parental anxiety induced by a false positive screening result disappears after 6 months, and to assess whether a special program to inform parents prior and during the screening procedure prevents or diminishes parental anxiety. So, to do this, the authors used a qualitative descriptive research design with purposeful sampling that was used to select subjects in order for the sample to represent the characteristics, opinions, and experiences for the population of interest, which creates a more representative sample. 22 focus groups were used with 3 individual interviews, and these focus groups consisted of parents were in one group, healthcare providers were in different groups, and the newborn screening professionals were in a third type of group. And there was a moderator's guide created for the group leaders. The results of this study showed that parents preferred brief information about the benefits of newborn screening, the possibility of needing a retest, and the importance of returning for a retest in a timely fashion. They wanted the information to be presented orally in the 3rd trimester of pregnancy, but also would have liked a concise, easy-to-read brochure with contact information after introducing the topic of newborn screening. Providers, on the other hand, desired a checklist of information and resources to prepare them to educate parents effectively. Now, this is showing the importance of finding out how parents in North Carolina feel about the newborn screening brochure that they are potentially going to be given in order to make sure that they are being educated as effectively as possible. So, in order to give them a concise, easy-to-read brochure, we're going to talk with them and see, well, what information do you want on the brochure using the information gathered from this study. The strength of the study include the diverse sample, which improves the generalizability. The moderator guide provided consistency and limited threats to external validity as much as possible. But limitations to the study included a lack of random sampling. The participants only were from 6 states, and only 3 parents had a false positive result. There was recall bias of the participants, and researchers were involved with the focus groups and the data analysis, which introduces threats to internal validity through investigator bias. So the purpose of my study is going to be to evaluate parental needs in North Carolina regarding newborn screening and assess the readability and ease of understanding of the current brochure, and using that information to provide parents with the information to hopefully reduce anxiety in the light of a positive screen and aid physicians and genetic counselors with discussing the meaning of the results and the next steps for children who screen positive for newborn screening. My research questions are going to be: what are prenatal experiences with receiving newborn screening information? What recommendations do parents have to improve the communication of this information? And what are parental opinions about the new North Carolina brochure and how would they change it? So these are my resources. Thank you for listening.